Bhati Mahatma sir is joined. Can you please change sir's name?
Am I
Morning,
visible? Good morning, everybody. Am I visible?
So you are visible, sir, and audible also, sir.
Okay, thank you.
Good morning, sir.
Good morning, Dilip Kumar ji. Good morning. And happy Nurses Day.
Thank you, sir. Same to you, sir.
Thank you, thank you. Can you hear me, Dilip Kumar?
Yes.
Talk for 2 minutes or not? Is there any talk for me? Do you have the address?
Yes, sir. So you have an address, sir.
But I have a parliamentary meeting. According to the address, is there any talk for me? Do you have the address?
There is a talk, sir. I can hear you and understand. Do you have an address? You have your address, sir.
But I have a parliamentary
Our address is right at the beginning, sir.
By Bharti madam.
Do you have the address?
There is a talk, sir. I can hear you and understand. Do you have an address? You have your address, sir.
Bharti.
Yes.
Our address is right at the beginning, sir.
By Bharti madam.
Do you have the address?
There is a talk, sir. I can hear you and understand. Do you have an address? You have your address, sir.
Bharti. Yes.
Our address is right at the beginning, sir.
By Bharti madam.
Do you have the address?
There is a talk, sir. I can hear you and understand. Do you have an address? You have your address, sir.
Bharti.
Good morning, Mahatma sir.
Yes.
Our address is right at the beginning, sir.
भाई भारती मैडम बोल दिया क्या इसको बंद करो ना.
Happy Nurses Day to everybody. Good morning.
Good morning sir. Good morning. Happy Nurses Day sir. मैडम को अभी can we tell the madam to join?
Sir, just passed a message, sir.
नहीं, they are asking. Yes, madam has come. Good morning, madam.
नमस्कार नमस्कार
नमस्कार.
नमस्कार विकास जी.
नमस्कार.
प्रणाम. नमस्कार
डॉक्टर भारती जी. नमस्कार
जी.
Ma'am, may we have your permission to begin, ma'am?
जी.
May I request all to please put on their videos? Bharti, can we start? We are live. Bharti, can we start? You're on mute.
Yes, ma'am. Just 1 minute, ma'am. People are joining.
Okay.
87 have joined. It'll take time for them. Yes, ma'am. Just give 1 minute, ma'am.
Please let us know then. May I request all the dignitaries to please check their audios? We can all unmute and just say, just to check.
Hello, everybody.
Good morning, sir. We can hear you, sir.
Yeah.
Good morning.
Good morning.
Good morning, all of you.
Good morning, everyone.
Morning.
Good morning. Good morning, ma'am. Namaskar. I think we can start now, ma'am.
Thank you, Bharti. Good morning to all. I, Lieutenant Colonel Dr. Sarabjit Kaur, welcome all the nursing fraternity who have joined us this morning on the virtual platform and wish each and every one of you a very, very happy Nurses Day. We still are having more participants joining us and we look forward for you all to cross the limit, after which I think 3,000 of you can join in this, and the remaining will be able to hear all of this through the recorded YouTube that is going to be put. We have all gathered this morning to celebrate the spirit of nurses in the International Nurses Day celebration of 2022. We know that this is the birth anniversary of the pioneer of modern nursing, that is Florence Nightingale. This morning, we welcome the honorable dignitaries from Ministry of Health and Family Welfare who have joined us. Ma'am and sir, we are extremely privileged to have you with us this morning. We have with us Dr. Vikas Mahatme, Honorable Member of Parliament, Rajya Sabha, Dr. Bharti Praveen Pawar, Honorable Minister of State, Ministry of Health and Family Welfare, Dr. Manohar Agnani, Additional Secretary, Ministry of Health, Family Welfare, Mrs. Hekali Zimomi, Joint Secretary, Medical Education, Ministry of Health and Family Welfare. Ma'am and sirs, we're extremely glad to have you with us, and we would like to welcome you with this beautiful virtual bouquet of flowers. Welcome, ma'am. Welcome, sir. From the team of INC, we have with us Dr. T. Dilip Kumar, President, Indian Nursing Council, Dr. Asha Sharma, our Vice President, Mrs. K.S. Bharti, our Joint Secretary, Dr. Punita, she's a Senior Consultant and ex-Dean of CMC. We welcome each one of you also. The International Nurses Day, we all know it honors and celebrates nurses as an invaluable resource and raises awareness of the challenges that they face each year. These challenges have especially been brought out during the past 2 years in the pandemic phase. The theme given by the International Council of Nurses for the year 2022 is Nurses, a Voice to Lead, Invest in Nursing, and Respect Rights to Secure Global Health. It is now my pleasure to invite our honorable guest, Dr. Vikas Mahatme, Honorable Member of Parliament. Sir is a Padma Shri awarded Indian ophthalmologist, a visionary leader, a social entrepreneur. He's also a member of our Indian Nursing Council. Sir, we may request you to kindly address the nursing fraternity. So you're muted, sir.
Namaskar. Am I audible now?
Yes.
So you're audible.
Dignitaries present here, our Honorable Minister for Health, Dr. Madam Bharti Pawar ji, our President, Indian Nursing Council, Dilip Kumar ji, our Secretary, Manohar Agnani ji, our Joint Secretary, and our Sarvajit Kaur Madam, Asha Sharma Madam, and so many other dignitaries present here. At the outset, I shall like to bow with respect to all the fraternity of nursing, because they have worked very hard during the pandemic, as you know all, and we could successfully prevent the growth of the patient suffering from the pandemic. So we could prevent that to a great extent because of the efforts put in by the nursing fraternity. Today it's another Nursing Day, International Nursing Day, and the topic or the thing in which we are going to invest in nursing. That is, we have to invest in nursing and respect the rights to secure global health. And I think our Health Minister, Honorable Mansukh Mandviya, has already started investing in nursing, as you know, because nearly we are expecting around 86,000 nurses will be required in midwifery, and they will be trained for that, and the jobs will be created because we are short of nurses, and so we need trained midwifery personnel. So investment is already started and we are on the right track. And I shall say that the first person to touch the body of a baby who enters this world, and that is the nursing personnel, nurses, and the touch is of care, compassion, and gives confidence to the mother as well as everybody and the child also. So with all this, I think we will be able to go ahead in healthcare, because all of us know that healthcare delivery will not be possible with quality without the services of nursing personnel. So I salute all the nurses for their dedication and for continuous efforts to improve the healthcare. I shall at the end like to say Happy Nurses Day to everybody, and thank you very much. Namaskar.
Thank you, sir, for your very encouraging words. We are indeed honored to hear these words from you this morning. May I now request Dr. Manohar Agnani, Additional Secretary, Ministry of Health and Family Welfare, to please take this invite of addressing the nurses fraternity. Sir is of the Indian Administrative Service batch of 1993 and has a master's degree of international health from the reputed University of Copenhagen, Denmark. Sir has worked in various administrative capacities in the government of Madhya Pradesh and has more than 18 years experience in public health. Currently, Sir is the Additional Secretary Medical Education in Ministry of Health and is also holding the post of Nodal Officer of National COVID-19 Vaccination Program in the country. We welcome you, sir.
Thank you. Good morning, Honorable Minister of State, Health and Family Welfare, Government of India, Dr. Bharti Praveen Pawar Madam Ji, Honorable MP Dr. Vikas Mahatme Ji, Dr. T. Dilip Kumar, President, Indian Nursing Council, my colleague in the Ministry, Joint Civil Education, Ikali Ji, Lieutenant Colonel Dr. Sarabjit Kaur, who is the Secretary of INC, Asha Sharma Ji, and other distinguished members. On this celebrity occasion of the International Nurses Day, I am delighted to be a part of this August gathering. Every year, International Nurses Day is celebrated on 12th May worldwide to commemorate the birth anniversary of the founder of modern nursing, Madam Florence Nightingale. On this day, we celebrate the contribution of all the nurses across the world. I take this opportunity to express my gratitude to our nurses for their selfless service during the pandemic and acknowledge their tireless effort put forth each day to revive or to recover a life. I strongly believe that nurses and midwives are the backbone of a responsive and efficient health workforce. I want to extend my wishes for our nurses overseas who earn recognition and appreciation for the skills and the expertise of Indian healthcare professionals. As a virtue of their dedicated efforts and services, the world today is looking towards India for trained and competent workforce to provide quality care in their nations. This year's theme, Nurses, a Voice to Lead, Invest in Nursing and Respect, Right to Secure Global Health, is appropriate and timely. And in India are already aligned to this theme. Under leadership of Union Health Minister Dr. Mansukh Mandaviya ji, and Minister of State, Dr. Bharti Praveen Pawar ji, we are working on the nursing reforms under the initiative of Heal by India. We understand that the healthcare scenario is evolving fast to keep pace with the technological advancements and changing demands. The role of nurses is also transitioning world over to accommodate the evolving needs of nations, population demographies, and emerging opportunities. I think that a powerful nursing sector can only be built by a robust nursing workforce that is appropriately educated, trained, and supported for innovative practice roles in various healthcare settings. The brainstorming session, Chintan Shivir on Heal by India, have highlighted the need for more significant investment in nursing education and jobs and strengthening leadership and policies influencing nurses and nurses' practice. The government of India has taken several initiatives to strengthen nursing and midwifery education and services. A specialized cadre of nurse practitioners in midwifery are to be placed in midwifery-led care units, and nurse practitioners in critical care are being created for ensuring empowerment, improved career progression, and meeting the global demands. BSc nurses are being placed as community health officer in health and wellness centers to provide essential healthcare in rural setups. And we have encouraging results of them serving as community health officer. Government of India is also committed to generate energy through implementation of nurse practitioner cadre for developing higher responsibility-related roles for nurses as important part of multidisciplinary teams in prevention and management of disease. Additionally, Government of India is also working towards strengthening of educational institutions and curricula to bring our quality of teaching par with the global standards and for ready acceptability of our professionals as per the global requirements. I feel confident that through very strong intersectoral coordination and focus inputs in plugging the service-related gaps, India will also be able to open a number of career and growth opportunities for its nurses in near future. I'm thankful to our nursing professionals once again for their untiring efforts and selfless service for the humanity. Wish you all a very happy International Nurses Day 2022. Namaskar. Jai Hind.
Thank you so much, sir, for your words of wisdom and encouraging all the nurses of the country. It is now my proud privilege to invite Dr. Bharti Praveen Pawar, Honorable Minister of State, Ministry of Health and Family Welfare. Before assuming the present prestigious appointment, ma'am has held various key appointments like Member of Standing Committee on Health and Family Welfare in the Parliament, Member of Petition Committee, Member of Consultative Committee for Skill Development and Entrepreneurship. Ma'am was awarded the Best Debut Woman Parliamentarian Lok Sabha for the year 2019 by the Honorable Vice President of India. We are indeed very grateful to have you with us this morning, ma'am. May I now request you to kindly say a few words to our nursing fraternity.
Thank you so much. Am I audible?
Yes, ma'am.
Yeah. Very good morning to all of you on this occasion on International Nurses Day 2022. I welcome all of you, Dr. Vikas Ji Mahatme, Honorable Member of Parliament, Additional Secretary, Dr. Manohar Agnani Ji, Joint Secretary, Hekali Madam, Dr. Dilip Kumar Ji, President of INC, Lieutenant Colonel Sarvajit Kaur, Dr. Asha Sharma, Dr. K.S. Bharti, Dr. Punita, and all who join with this great occasion on this virtual platform. I welcome you all. I'm very happy to be present here, and I would like to greet you all on this occasion of International Nurses Day. International Nurses Day is a global event and that observed on birth anniversary of Florence Nightingale, the founder of modern nursing, to honor the nurses in healthcare for their diligence and service to society. I would like to offer my facilitations to the entire nursing fraternity of a country on International Nurses Day for their dedicated and sincere service to the nation. At this juncture, the country salutes all the nurses. Friends, I belong to medical background and have seen the working of nursing staff very closely. There is no doubt that doctors play a vital role in healthcare industry. However, it cannot be denied that nurses are equally important. Nurses are the most important link between a doctor and the patient. A doctor prescribes medicines and makes the diagnosis, but the rest, at the last, it is a nurse on whom the actual responsibility of the treatment depends. And nurses are the heroes who attend to the needs of their patients, be it day or night, without a frown on their face. They are the backbones of the healthcare industry who tirelessly take care of all the requirements of the patients. Therefore, the observations of the International Nurses Day becomes all the more significant considering these facts. Friends, the role played by the nursing fraternity is tough times that whole world has faced in the recent past is remarkable. No words are enough to thank the contribution made by the nurses during COVID pandemic. This fills us with a deep thought of gratitude and respect of this noble profession. Nursing is currently the largest occupational group in the health sector, accounting for approximately 59% of the health professionals. Nurses are the first point of contact, and this makes their role all the more important in the healthcare delivery system. A strong nursing sector is an essential building block of a strong healthcare sector. Nurses are the foundation of hospitals. The way you cannot build strong houses without strong foundations. Similarly, you cannot create a good hospital without great nurses. Nurses are the heart and soul of caring. Friends, as nurses plays a key role in individual and communities' health, investing in nursing will help in achieving our objectives of universal health coverage through improved health services and disease prevention. As told by Dr. Agnaniji, the government is doing some work on this platform. The future on Healthy India in strengthening primary, secondary, and tertiary healthcare services to serve the people. National Health Policy 2017 recommends standardized quality of clinical training, ensuring the quality of education, continuing nursing education, and on job support to providers, especially those working in rural areas, using digital tools and other appropriate training resources. The global COVID-19 pandemic has shown us the important role of nurses have played in keeping people healthy. The future of global healthcare, particularly in India, is and will be greatly influenced by this pandemic. This crisis situation has exposed several challenges and opened up the opportunities for prognosis, progress, innovations, and the changes that must invite new models of care where nurses are at the center of healthcare. I'm happy to state that our Ministry of Health and Family Welfare, under the visionary leadership of Honorable Prime Minister Modi ji and our Cabinet Minister Mansukh-bhai Manviya ji, has initiated the development of a technology platform called the Live Register in the collaboration with Indian Nursing Council and development partner. The Indian Nurses Live Register will include capturing of up-to-date and latest information of the currently practicing nurses, which would help the government of India in better manpower planning and for making the policy level decisions for the nursing professionals in India. I am delighted to know that Indian Nursing Council has also set up a skill simulation lab in Delhi, NCR, to provide state-of-the-art training to nursing faculty. Further, it is a welcome step that nurse practitioner in critical care residency program has been developed by INC, and specialized courses in geriatric and psychiatry nursing are in pipeline. Friends, the role of nurses are evolving and changing. Nurses can contribute significantly towards strengthening system to work efficiently in interdisciplinary teams. As a key member of the healthcare team, you can effectively participate and influence policies related to nursing at local level, state level, and national levels. The changing roles will also improve their contribution at international levels. Nurses have always earned tremendous goodwill in all the parts of the world. Friends, as a nurse, you have the opportunity to heal the mind, to heal the soul, to heal the heart and the body of the patients. Patients may forget your names, but they will always remember the experience they had while they were vulnerable. And this is the role that not everybody gets to play. As nurses, you have the opportunity to make a few lives better every day. This is a unique feature of this noble profession. There are always a few parameters when people are drawn to something, but for nursing, only thing that drawn towards it is a desire to care, to help, and to serve. Friends, nursing is not only the profession, but it's an art, and this art fits your soul. It is itself is one of the finest art. Caring for one is love, but caring for hundreds and thousands is nursing. Friends, I take this opportunity to extend my best wishes to all nursing fraternity and their families. You chose to be a nurse because you really have a gift to serve others. With your professionalism and your kindness, you gladden the hearts of those who are sick. You are an angel who watches over health and brings relief to patients who often find themselves without comfort. The country is grateful for your selfless service, compassion, and dedication. And I wish you many congratulations on this Nurses Day. आज इस अंतरराष्ट्रीय नर्स दिवस पर आदरणीय मनसुख भाई मांडविया जी की तरफ से हमारी सभी हेल्थ मिनिस्ट्री की तरफ से और सभी भारतवासियों की तरफ से आप सभी के हमारी नर्स की धैर्य, सहानुभूति और आपकी कौशल के लिए मैं बहुत बहुत धन्यवाद देती हूँ। धन्यवाद। जय हिंद।
Thank you, dear ma'am. These were very, very kind words to all our nurses, and I'm sure that your encouragement will go a very long way in re-energizing the nursing community. We thank you, ma'am. May I now request Dr. T. Dilip Kumar, our President, Indian Nursing Council, to deliver the vote of thanks for our august dignitaries.
Am I audible?
Yes, sir.
Good morning to all of you. Honorable Minister for State for Health and Family Welfare, Dr. Bharti Praveen Power Madam Ji. Honorable Member of Parliament, Padma Shri, Dr. Vikas Mahatme Ji. Additional Secretary for Medical Education, Dr. Manohar Agnani Ji. Joint Secretary Medical Education, Madam Hekali Madam. Dr. Asha Sharma, Dr. Punita and Bharti and other fellow nursing and midwifery professionals across the country and abroad. On behalf of the Indian Nursing Council, I would like to extend greetings to all of you on the occasion of the International Nurses Day, which is celebrated globally to commemorate the birth anniversary of the Florence Nightingale, who is the founder of the modern nursing. It is my proud privilege to deliver a vote of thanks on the occasion of the International Nurses Day on a virtual platform. I take this opportunity to thank our Honorable Minister for State for Health and Family Welfare, Dr. Bharti Praveen Pawar Madam Ji, for gracing this occasion in spite of her busy schedule and addressing the nursing fraternity. Madam, your kind words, your presence today in this function has immensely enhanced its importance. We are extremely grateful for your insightful address, which will motivate many younger generation of nursing and midwifery professionals. You always encouraged and remembered the nursing fraternity for their valuable services they have rendered during the COVID-19 pandemic. And also you have highlighted how our nursing and midwifery professionals are important in achieving the universal health coverage. I also take this opportunity to thank our Honorable Member of Parliament, Padma Shri, Dr. Vikas Mahatme Ji, for participating in this important celebration and addressing the nursing and midwifery professionals. Sir, you always supported for the growth and development of the nursing and midwifery sector, and also you have always gave a suggestion how to improve the quality of the nursing education and how to reach out to the in the rural area, to the unreached population. The nurses are the best suited. That's always used to raise this issue in our meetings. So I would like to thank you for participating in this very important occasion, sir. I also take this opportunity to extend my sincere thanks to the Additional Secretary, Medical Education, Dr. Manohar Agnani Ji, for making it convenient to participate in this International Day celebration. Sir, you always took interest in policy planning for the growth and development of the nursing and midwifery profession at the global level and also at the national level. Your interest in planning the strategies for the improving the nursing and midwifery sector is always memorable, and I have seen how you take the interest in pushing the nursing sector in various platforms. Thank you very much, sir, for your for gracing this function, sir. I would like to extend sincere thanks to for gracing this function to Madam Hekali Ji. Madam, your commitment and your sincerity, and I have always seen how much efforts you make it to reach out to the nursing professionals, and also you are always working out the strategies and solutions to improve the issues and challenges our nursing and midwifery sector which is facing. And also you are already working on some of the various measures to address the issues and challenges which the nursing and fraternity which is facing. So I would like to extend our sincere thanks for gracing this function, madam. I would like to acknowledge the sincere efforts put by the organizing team in the Ministry of Health and Family Welfare and also in the Indian Nursing Council to bring this the celebration on a virtual platform to make this program a grand success. This is an opportunity time to enable possibilities for better investment in education, jobs, leadership, service delivery, improving the quality of the nursing and midwifery education, planning for a better working condition, creating a career opportunities, and implementation of the various nursing specialty courses like Dr. Manohar Agnani Ji mentioned about the nurse practitioner critical care program and also the nurse practitioner midwifery program. and also planning for a better optimum nurse-patient ratio in the healthcare delivery system, and the effective nursing manpower planning, implementation of the nursing registration system, which has been digitally planned by the Indian Nursing Council, wherein we have already captured the data of linking the Aadhaar with the 10.3 lakh nurses. And we are in a way to freeze this whole program so that it will facilitate for effective manpower planning, nursing manpower planning at the district level, at the state level, and also at the national level. And also focusing on the evidence-based practices so that the different evidences which are available, which will facilitate for planning the protocols for working out in the clinical setting, so that the nurses will be able to provide a competent and skillful nursing and midwifery and qualitative nursing services in the rural area, with the aim of achieving the Sustainable Development Goal, where the India is a signatory and in the United Nations. There is no better incentive to make nurses and midwives more central to all health system, and to ensure that they are educated and encouraged and treated better as they are valued professionals. Once again, I would like to extend my sincere thanks to one and all for making this today's celebration a grand success. Thank you very much. Jai Hind.
Thank you, sir. On behalf of Indian Nursing Council and all the nursing community that has joined us on this virtual platform, we once again thank the Honorable Minister and all the esteemed dignitaries who have taken out time to be with us and to salute the nurses. We are thankful to have each one of you on the celebration of this International Nurses Day. Thank you all. We'll take a short break for 5 minutes and reassemble for the second half, that is the webinar on the theme. I request everybody not to log out. All the participants have joined us virtually as we reassemble after 5 minutes. Thank you, everybody. Namaskar. We request all to please put on your videos. May we request all to please put on your videos. We just like to know who is joined through Dr. Manohar Agnani's link so that we can change the name.
Dr. Punita ma'am, can you stop the share, please?
Can you please ask who is joined with the link of Dr. Manohar? Can you please put on the video, please, so that we can change the name? Madam Khurana. Welcome, ma'am. Ma'am, you are muted. Dr. Roy was supposed to join, but we are not able to contact him now. Should we wait or can we start?
Mrs. Kaur, is it pick?
So we can hear you, sir. We're just waiting for Dr. Roy to join.
No, you are able to contact by phone?
Hope Dr. Roy can hear us, sir. Have you joined through the attendees link? If so, like what's your name? TNAI or TNAI headquarters? If so, let us know. I'll put you to the panelist link. Just put a chat, please.
Sir has joined, I think, as an attendee. He's just joining in. Can we start meanwhile, sir? Or should we wait?
Yes, he's joining and change the name.
Yes, sir. So please maybe start.
We'll change the name. We'll change the name. That's not an issue. Let us.
Can start now.
Thank you, sir. So all our dear friends, welcome back to the second half of the webinar. And once again, wishing each one of you a very, very happy Nurses Day. In the last 2 years, nurses across the world have been working tirelessly, making great sacrifices in the face of the global health threat that was there, and continue to save and serve as many as they could and prove themselves to be an indispensable pillar of unwavering dedication to our healthcare system. In this half now, we are going to have more deliberations on the theme of the International Nurses Day. I welcome the dignitaries who have joined us in the later half. We have with us Mrs. Khurana. Madam is the General Secretary of All India Nurses Federation. And we're also going to be joined shortly by Dr. Roy, President TNAI. There was some link issues, but I think Sir is joining us now. Sir, are you there? Can you put on your video, please?
Yes, I am there. Yeah.
Welcome, sir.
Yeah.
We'll just get the name changed for you, sir.
Yeah.
We also have Dr. Punita, who is the senior consultant with us, and Dr. Ashish Sharma, who is our Vice President, Mrs. K.S. Bharti, our Joint Secretary, and of course, the team leader under whom we all efficiently work, that is Dr. T. Dilip Kumar, our President, Indian Nursing Council. Now I invite Dr. Punita to deliberate more on the theme of the International Nurses Day. Over to you, ma'am.
A very good morning to all. I'm just given 4 minutes. So I will be very briefly presenting the theme. We won't go very much in detail, except that just unfurl the theme. Esteemed speakers and audience, Happy Nurses Day. ICN, which is a global voice, commemorates this day, May 12th, as International Nurses Day. And on this day, they announce a particular theme. And this particular theme echoes the voice of all the nurses. And during this time, the ICN toolkit will be released with various resources and evidence for distribution. And through this webinar, we are celebrating this day, organized by Indian Nursing Council in collaboration with Ministry of Health, Family Welfare. And very especially at this time, we remember and thank all our nurses at this time who have been working so hard during the pandemic, who have lost their lives and their families, we remember, and who are also currently working, serving them and working amongst them. And we have heard enough about the theme of today. And I would straight away go into the theme and what the components of the theme and important verses, words from each of the state. This theme, Nurses a Voice to Lead. You might have been hearing this theme is being echoed again and again. It shows the significance of integrating nurses' voices for leadership towards healthcare provision and healthcare management. Are nurses' voices heard? Is it necessary for nurses to give leadership and also articulate the needs of nurses and also our patients? So that is continuing from 2017, and ICN being a global voice made this very, very significant and echoing the same theme, Nurses a Voice to Lead. And the sub-theme for this year, you find invest in nursing and respect rights to secure global health. Last year, we had vision for future healthcare, how significant it is for involving or integrating the nurse's voice for envisioning the future of healthcare. And today, this year, it is investing and respecting nurses' rights. All these are important to secure global health. Investing in nursing, we have been hearing for quite some time from the International Year of Nurses and Nurse Midwives from 2020. And quite a number of documents have been prepared in this line. And this theme demonstrates the need to invest in nursing to build a resilient and a highly qualified nursing workforce, to protect nurses' rights in order to transform health systems to meet the needs of individuals and communities now and to the future. It shows that a lot has to be invested, and a lot has been invested since 2020. Plans have been made by various countries, particularly India. We know that there has been a delay in view of the COVID pandemic, which still threatens us or threatens many countries. And investing may not be seen immediately. It is not something that can be visible tomorrow, but it will be seen in the long run. It is not only on the nursing and nursing sector, but it will be seen on the entire health system and the health care of the country and world. Secondly, rights. We all talk about human rights so importantly, and everybody, even the children's rights, patients' rights, adults' rights, and ICN is emphasizing this. Why? Because there is some weakness in this particular area, how to protect nurses' rights, provide safety for them. This is also important in order to transform the health systems and not only meet the needs of the nursing society, but the individuals, communities whom we serve today and for the future. And many of the recommendations that have been presented in various reports, the State of World Nursing Report 2020, the State of World Midwifery Report 2021, the Global Strategic Directions for Nursing, Midwifery 2021, all of this reiterated the importance of investing in jobs, education, leadership, and service delivery in nursing towards health system strengthening. And the WHO called for the member states to respond in this direction. And India has started responding, and several initiatives have already been mentioned by various speakers from the Ministry of Health and Family Welfare. And these initiatives have been from Ministry of Health alongside Indian Nursing Council. And placement of BSc nurses, CHOs in 150,000 sub-centers have been envisaged by Ministry of Health. Creation of NPMs for placement in MLCUs, 86,000, which has been mentioned earlier, NPM, and Indian Nursing Council has redesigned BSc curriculum to fit this role and also developed various nurse practitioner curriculum, NPCC, NPM educator, NPMs, and various specialty programs. And many of these efforts have been in line with investing in nursing education. And the Nursing Now Nightingale Challenge, which have started, particularly one important program I would like to mention, Leadership for Change program, which was brought to India by Indian Nursing Council. This is by ICN. 2 cohort of nurses, 20 each, have been trained as master trainers who will in turn will train other young nurse leaders of our country across the states who will be able to participate in leadership positions, particularly health system planning, strengthening, and also development. Various policy dialogue on nursing leadership, upgrading entry level of nursing educational program, creation of positive work environment, ensuring pay parity, well-planned policy for recruitment retention, closing education service gap. All these are on the progress. Dialogues have been already with various task force committees set up by Ministry of Health and Family Welfare, where Indian Nursing Council and other stakeholders participate. Dialogues have been going on. A National Nursing Midwifery Bill, setting up of National Nursing Midwifery Commission, all these are in pipeline to strengthen the nursing practice, regulation, and also as well as education. To conclude, the investment in the nursing workforce means that we can restore, we can transform, and strengthen the health systems to ensure health equity. By investing in nursing and respecting nurses' rights, we can build a stronger, more resilient, competent, and satisfied nursing workforce to meet the challenges ahead. And I thank INC for giving me this opportunity, and it is indeed a great pleasure to be part of this Happy Nurses Day once again. Thank you.
Thank you, Dr. Punita, for throwing light on the theme of the ICN this year. And very clearly you have brought out that yes, this is the case of investing in various aspects laid down in strategic papers that have been sent by WHO and the ICN, investing in nursing education, in jobs, and in leadership. It is indeed a time for action. Thank you, ma'am. In the last 2 years, as ma'am has also brought out, the World Health Organization and the ICN have collected data, and they have brought out various documents by populating it as National Health Workforce Account. We have seen this data in the State of World Nursing Report, State of World Midwifery Report, and Strategic Directions for Nursing and Midwives. To talk more on the role of Indian Nursing Council in this National Health Workforce Account, we have now Mrs. K.S. Bharti, our Joint Secretary. from Indian Nursing Council, and she'll be speaking more on the NRTS.
Thank you so much, ma'am. Let me first wish you all a very, very happy Nurses Day. As MOS, Dr. Bharti Paveen Madam said, as a nurse, we have the opportunity to heal the mind, soul, heart, and body of our patients, their families, and ourselves. They may forget your name, but they will never forget how you made them feel. This is from Maya Angelou. I think I wish you all a very happy Nurses Day. This is very important to first applaud ourselves and rather getting applause from others. I mean, we should be happy and proud to be a nurse. So now next, going to continuing from Dr. Punita's, that is investment in nursing. Yes, ANC has never gone back. I mean, wherever possible as a regulatory body, we are able to invest. That is, we have done a lot of virtual trainings for the midwifery faculty. And now we have invested on the NRTS also. And also we have having NRSC, where we are, helping all the faculty to build their capacity in the simulation. And last but not least, this NRTS. But where this NRTS come in, though we have started this NRTS conceptualization somewhere in 2008 and 9, but because National Health Workforce Accounts came into the existence only in 2019. That is after the SWON report. And how the SWON report is done? Having this National Health Workforce Accounts of each country. And this is collated, and then it becomes a SWON report. Right? Now, what is National Health Workforce Account? It's a system through which countries progressively improve the availability, quality, and use of data on the health workforce, and thus achieving universal health coverage, the United Nations Sustainable Development Goals, and other national and global health objectives. And what are the indicators? There are 10 modules in the National Health Workforce Accounts. That is on the three main issues that are education, labor force, and serving population and their health needs. So what is module 2 says? Like education says, education and training regulation accreditation, education finances, and we have active health workforce stock. Module 5 is, see, it's all interrelated. It's not interrelated, but it starts from education. That is where, what is the supply? So that's how we get it through the labor force. What is the demand? So that's a read. You see, when you go for education first, when we meet all the demands, then only we can go to the labor force and achieve whatever is required. And then comes the serving population health needs. If we have good number of nurses for the population needs, we can do a serving better. Now, I'll just tell you how NRTS, it is integrated, right? Now, our objectives is to, for when we started this NRTS, NRTS objective was to have online filling and submission of registration application forms. That is very important because we have 28 state nursing councils now with us, and unique identification of each nurse and midwife. What happens? There are same nurse having a different RNR numbers, because in the reciprocal, what happens? You get a new RNR, which is wrong, right? So we should have one RNRM throughout the life. That day I am working as a nurse, till the day I am working as a nurse. Ease of verification process across country. We see many people standing outside the SNRCs to get their verification process across the country, and as also for going abroad. And online availability of data of active and registered nurses and midwives across country through a computerized lab register. So I will show you, like yesterday, I took the data out, how many are active in our country, who are enrolled. You may say we have many nurses more, but till the data is there, till the data is there in the NRTS platform, we cannot say this many are live registered. So we need a lot of cooperation from the nursing fraternity. And Aadhaar enabled biometric. Why? Because we want a unique nurse to be there. And now it is, because after the COVID, UIDA has come with the OTP authentication. That is, whatever the mobile you have, in the registered mobile, you have a OTP authentication. So no, it is your number, it's your Aadhaar number, there you are registered, okay? And non-duplication of nurses and midwives. As I said, many have 4 to 5 RNR numbers to have a norm, because it is extrapolated. Though we have only 10 lakh nurses, maybe we are showing is a 20 lakh nurses, because if everybody has 2 nurses, or 2 RNR numbers, or if one nurse have 6 RNR numbers, so there the data goes haywire. So we should have a clean data with us, because whatever data we till date we are getting, it is from the state nursing councils. And primary registration will be done in a day. How it will be done? Because we have gone through across the country how to do a primary registration. I mean, we have done a number of trainings in all the states. I think 1 or 2 states are left behind. Otherwise, you have trained almost all the states and the nursing institutions how to go about this primary registration. And their responsibility is the principal schools of nursing and colleges of nursing will be responsible for all this. And digitally signed certificates. Now we'll have a digitally signed, so that you, like the way you get Aadhaar card or your PAN card online or the voter ID card online, you will also get your NID card online. You can always download till you get a hard copy from the state nursing council, because you know printing and then dispatching takes time. But till that, when SNRC verifies, registrars verifies your number, you can immediately download it. And primary and reciprocal registration will be issued. Quick verification process by the hospitals, because see what happens many a times we'll say a faculty is working in this organization. No, she's also working some other organization. So for them, for the principal, they say we do not know where she's working. So immediately with the NUID number, if she puts on the website, she'll know where the last she's been found, she's working, and whether she's telling the truth in her CV. Latest detail of the candidate will be available with the photograph. So, and I just want to request you all and to inform you and to remind you that this time INC will not issue the renewals till you are enrolled in the NRTS. I mean, that is a decision taken by the governing body of the Indian Nursing Council, and no more fake registration. And what is the outcome we expected? That is number of active nurses in the countries, and the students admission database program wise, how many nursing midwives candidates qualified program wise, number of Indian nurses migrating to other countries, number of foreign students studying in India, data available to all the stakeholders for verifications, number of nurses migrating in the country itself, because interstate migration can be seen, and survey can be done. Remember how you would have received SMSs and emails who and all is enrolled, but I don't know whether you have answered. All right, we do a survey through this, because at a one click of time, I can also give SMS to all 10 lakhs to nurses, right? INC can give message through SMSs and through email to the registered enrolled nurses, right? Because how we have the data, we have the number, and we have also given the opportunity to you, if you change your mobile number, if you change your email ID, that also you can do. So you can always go to the NRTS website and change your mobile number if it is changed, or if you can change your address, or you can change your, so this is why we call it nurse and midwives registration tracking system. And now we have received, like yesterday, just 10 days back, Union Health Minister wants to know how many nurses wants to go abroad. I want to know the data. So yesterday we received around 10,800 nurses are ready to go abroad. So when the minister asks, we can give the names and numbers of those nurses to the health ministry, who will then look into their opportunities and can give that opportunity. We can always inform them back where the opportunities are and where to apply. Right. So this is how these are interactive. It is not only that you are just putting your data on. The data has a lot of information available, which is interactive, because if you give us your mobile number, where we know we are working, we can always come back with a requirement from the ministry, from the government, or from the INC, from wherever it is, from any other stakeholder, from the commissioner of your district, right? He can also come to you for any assistance or any requirement for him from yourself. And migrating out as a number of nurses is available facility-wise. You also know in the government how many nurses are there, in private how many nurses are there, that also we'll come to know. And demography, where the density, where the hospitals are more in our country, where the nurses are there. For example, you must be having in Chennai, Bangalore, and in the main cities, but not distributed everywhere. Like in Delhi, we have many nurses, but in NCRs, we may have less. So that is where we can have a study wise that. So whether we can have more facilities outside the Delhi or in the NCR, so that our migrations, because the cost of living is less in the others, in the smaller cities, in the smaller towns. And number of nurses midwives distribution age group. Why? We know this many nurses are available, but by next year, if she attains the age of superannuation of 60 years, these many nurses will not be available. So we have to make a manpower planning from today itself, that in 2030, how many are going to retire and how many are going to come in. That is demand and supply. And number of nurses, midwife distribution by gender, whether how many nurses are required, as male nurses are required in the male wards. So whether they are less, whether they are more. So all this can be looked into a data. So let me show you the data. This is the one yesterday at 11th. On 11th May 2022, I got at 3 p.m. I got from my NRTS website. This is the data. That is ANM enrolled. I can't say how many because we have around 9.6 lakh ANMs registered in our country, which we get from the SNRC every year, right? But now it's only 2,61,377 has, enrolled in this NRTS system. So we have to make a study whether what is the gap of 7 lakhs nurses now? Where are they? Whether they are retired, they are no more working as ANMs, or they are not enrolled themselves in the NRTS. And this will be taken the help of the state nursing councils. And GNM, it is 5,60,787 and 2,19,904. So this is a bifurcation of RM registers because both GNM and BSc get the registered nurse and registered midwife. So there's a bifurcation. That means almost I have 7,89,000 nurses available. But as per the data from the SNRC is 27 lakhs. So this is 20 lakhs difference. So whether it's a duplication is there, whether they have not registered. So all we have to look into, and we have to ensure the state nursing fraternity for their good, they have to enroll in this NRTS platform, which they can do on their own. They don't need any agency. Though we have enrollment agency called Finopaytech with us, but still they can do independently on their own online. And out of this, nurses, 7 lakh registered nurse and midwives, we can also see how many have attained additional qualifications, right? The post-basic diploma, it is around 1640, and for post-basic BS is 30,990, and MSc it is 18,666, and MPhil, 87 MPhils are there in our country, PhD 448, so grand total is 51,821. That is only not even 5% have got this additional qualification. So I do not know whether the educated people are not enrolled themselves, because we all know that every year we have around 9,000 to 10,000 MSCs are qualifying. So where are they? Where are they? Because according to us, at least 30,000-40,000 numbers should have there in MSc nursing. So that's why I'm telling you, the qualified people have to enroll themselves. They have to take a time of 20 minutes only for a day and to enroll themselves. So this is female and male ratio of number of enrolled nurses. Around 12.8 are males and 87.2 are females. And this is the age group. Now look into this data. From serial number 2 to 4, you have almost around 6 lakh nurses, right? 6 lakh nurses are there out of 7. So this is a group which is very active as of now. So we have a young India. Yes, from 26 to 40 age, we have 6 lakh nurses. But where are from 18 to 25? We can't have 18 years of age for the staff nurse. I understand it is only after 21. But from 21 to 25, there are 43,000 only. That means the teachers have to encourage all the qualified nurses to get the primary registration. Because they're not getting enrolled, they're busy in making their future, they're busy in getting their jobs. They don't feel that they have to get enrolled here. They don't know the importance of the nursing registration tracking system. So this is where we have to ensure that this data comes up, because if I share this data, if we share this data, Ministry of Health, it will be wrong. They say that we don't have nurses in this age group. We don't have nurses. Where do we get it? So you open n number of additional nursing institutions, sometimes which may not have admissions there. So we're looking into the admissions, we're looking into the nursing institutions, whether this is required in this particular state is requirement only when your data is correct. And as I said, coming from the very first slide on the education. So how do we get the data? That is, what is strategic direction for nursing and midwifery in the NHWFA, that is National Health Workforce Accounts. It is to have broad engagement. Broad engagement with whom? We had a broad engagement before coming to the NRTS portal. We had a lot of meetings with the State Nursing Registration Council, right? We have a lot of meetings with this because this is just a platform. This is just a platform. There is no legal issues in getting this platform used. Remember that, because it's just a software platform, so that the data The money which you give for the primary registration will go to State Nursing Council also. He or she, I mean, whichever state they belong, the registrar can see their data, what I'm showing it today for themselves for particular, their state. Right? It is at the all India level, but at their state today also, at the click of button, they will know how many nurses are registered, how many are primary registered, or how many have this age group, or how many male and female are there for any decision making of in their state. Right? And broad engagement, that is, we have taken SNRC on board. We have gone to each health facility from our Indian Nursing Council through Finopatech, who has been selected as a vendor to collect the data and put it on the NRTS platform. That's for enrollment. I think many of you would have seen people going to your facilities and coming to enroll and take your thumb impression. Now it is going to be OTP based. Then coming to the data. So we have got only data is very minimal, as according to me. We need more data on this, and we have a dialogue. How can we have a policy dialogue? How can we go back to you and how do we get it? And the decision making. When we have a data, the correct data, because whatever data we have, it has to be convert into decision making. Like we have in private nurses, in public nurses, there's a gap of wages, right? Whether there's a 12 hours of working, whether it's 8 hours of working, all this we have not still included it. We will include as and when our data gets much more better, so that we know people are reacting, they are reactive, whatever we are putting on the web, on their SMSs. If you do that, then it will be easy for the decision making, and it's easy for us, the policy makers, especially Ministry of Health, to make a policy makers. Like for example, nurse practice NPCC, right? You all talk about NPCC. I think around 200 NPCC have come out in our country. But they say they don't have a job. But where are they here? Their name is not in the NRTS system. If their names are there, then we can say number of NPCCs are this many, and they have qualified, but they have not got a job. They're only working here. So we need a better cadre for them. So like this, we need to ensure the proper data available in the country. How do we do it? It's all with you. It's all from you. This data is generated. INC cannot generate on their own. It has to be generated a correct factual data from your end. And that is what is yesterday 3 days triad meeting. We had data for dialogue and decision making. I mean, that is what is emphasis in the last 3 days in the triad meeting from WHO was going on with the data. And data is for the dialogue. Dialogue means how do we go about, how do we come out? When we have a data, we analyze it and we place it. A lot of data are made, reports are made out of the data. And then decision making. When you get a report, then decision making, how to go about, how to improve our cadre, how do we go about, whether we have additional qualifications to be done apart from what we are existing, whether our nurse is able to work, able to get, a lot of things are there. So I just want to, before I say thank you, I just want to go back to the first slide, which says education, right? So education and training, we know how many institutions are there available in our country, but how many nurses are there. But now, because of enrollment, we are able to come out of the active nurses. But education, training, regulation, accreditation, it will say how many dropouts are there. So that's the way coming out of the nursing admission module. It is not to give you a problem. See, whatever you're doing in your Excel sheet, if you put on the NRTS platform, it is available with you. Login and ID password will be there with you. So you don't have to have your own Excel sheet or your own specific apps to be done in your university, but instead you can always enroll in the NRTS platform, which is free for you, right? And we don't charge, right? Whatever primary registration is charged, the fee that will go to State Nursing Council. So we'll know how many admissions were there since 2016 until 2020, because I have an estimate as of now that 99% education system, has improved in the GNM, and also 88% because of my renewal data. But this will give you, when you have an admission, like you have 40 admissions, only out of 40 admissions, you had a full admissions. But when you were after the 3 years or 4 years of training, you have only 25 or 35 qualifying. So that means there's a dropout rate or the failure rate we need to examine. That becomes a decision making. That becomes a report for us. Then it will turn into decision making, whether the question paper was tough for them, people did not answer, whether they dropped out, they did not continue the program. So that is why we require an accreditation, because there are n number of institutions. INC gives only, something like you can say pass. If one is pass, a good institution is also pass, and the very best institution is also pass, and average institution also pass. So everybody gets a what do you call it, suitability. But we don't rank them. So accreditation is also important, which will come in the NNMC, as Madam said, the bill 2020, right? But still it needs to pass from the parliament. Education finances, we are not looking into it because this becomes how much we are investing on each nurse, how much on the teachers, how much health facility. So this we will take it later on. As of now, we only want active health workforce stock, that is the density. And what is the health labor market flows? Whether they get the job within 6 months, within 1 year, within 2 years. So that is the reason we need to have this module 5 is better for us, and then module 6, employment characteristics and working condition. We have not given a lot of variables on that. We are only looking into the emoluments, but we are not looked into the hours of working. So that can be integrated, but first we want more of the information what is available as of in the NRTS platform. And we have health workforce spending and enumeration. This will all come out once you start have the data of 100% data of our nurses in NRTS platform. This all will come skill mix composition for models of care. Though it's going on, a talk is going on the Ministry of Health of task shifting and sharing. But this skill mix will also come once we know how many nurses are available, how many are required, whether we need to do a skill mix, like we do have a lower cadre helping to the nurses as a staff nurse, and governance and health workforce policies. Now, this governance and health work policies is later on comes on like whether what is the density, how do we go about, how are the things that is mechanisms to call it intersectoral health workforce agenda. This will come. This is at the level of the Ministry of Health and Family Welfare, because we give the nurses data, they collect from the doctors, they come from the other paramedics who are available, and then comes the governance and health is at the level of the government of India or at the level of the state government. Because when you give your data, at the state level, state paramedics gives, and the medical doctors they give, then this will come up. The health workforce information system. At the end of the day, when all these modules are done, we get a health workforce information system, because we all have code of practice will be there. Then we have attendance of birth requirements. Then we have outputs from education and training institutions and number of entrants to the labor market. So with this, all these modules will make a health workforce information system. So at the end, I would like to thank you a lot. Thanks a lot for patiently hearing me. But I just want to tell you, please visit for online enrollment to the NRTS, indiannursingcouncil.gov.in. Or if you're not able to click in, go to our website, go to your nurses registration tracking system, a live register for nurses. Okay, thank you. And I hope, because you're not seeing the improvement from last 1 year, I hope you will all help us, encourage us to make better in the nursing fraternity, so that we give you a better outcome through the Ministry of Health and Family Welfare with the government policies we can work on, because if we have a actual data with us. Thank you very much. I hope I have not taken much of the time, Secretary Madam. Thank you so much.
Thank you, Bharti, for that presentation. And we cannot emphasize enough on the importance of data. In the initial session also, our Additional Secretary, Dr. Manohar Agnani, brought out that there is a Chintan Shivir going on, wherein we are also being involved, and there are many projects in pipeline for linking this data that is there with various government schemes, as well as even with the migration, those who are going to go abroad. So we need to get ourselves registered so that we are aware, and we are in those numbers that are being compiled and being considered for these various government schemes. So thank you so much, Bharti. I now request Dr. Roy K. George, President TNAI, to kindly address. Sir is an alumnus of the Government College of Nursing, Kottayam, and he's a specialist in psychiatric nursing. And sir, we are very happy to have you with us this morning. Over to you now.
Thank you, dear Dr. Sarojit. A very warm good afternoon to all of you. It is 12 o'clock past, and greetings of the International Nurses Day to all my nursing colleagues and all the nurses who are attending the program. First of all, thank you and appreciate the efforts of Indian Nursing Council in organizing this webinar. Actually, Nurses Day mornings are usually, traditionally, we expect the Honorable Rashtrapati to give away the National Florence Nightingale Nursing Awards. since last 3 years, there have been disturbances due to multiplicity of reasons, and hope that at least the next Day, May 12th, we'll have the Florence Nightingale Awards distributed on the International Nurses Day itself. COVID has affected our schedules and when 2021 awards, but still I take this opportunity to congratulate all the award winners, because now the award winners know who are the award winners of the 2021 as informed by Indian Nursing Council. Let us all try together to bring back into the Nurses Day of the next year, 2023. And of course, the voice to lead the nursing. We have been trying to project the nursing community and the nursing leaders who will decide on the policy changes in the government, and such celebrations will definitely contribute to the importance of increasing the visibility of nurses as envisaged in the Nurses and Midwives for Change campaign, and as Indian Nursing Council and other professional associations were trying. And ICN has been consistently doing it, which we are all, let us all unite in this effort to strengthen the voice of nurses to be heard together. And in that, the contribution of professional associations, the trade unions, and statutory bodies are very important when we come together for a cause. And as the president of TNA, I am happy to announce that today evening we are launching the insurance scheme for nurses, the TNA members, a 10 lakh insurance as a welfare measure of nurses. In fact, we were planning to have a comprehensive insurance scheme, but COVID has taken the toll, and insurance companies are reluctant to give a comprehensive insurance because we are risk-prone people, doctors and nurses, and so we are having the accidental insurance, which will be launched today evening at 7 p.m. and all the TNA members can register. And it will ensure definitely it is going a long way in helping nurses who may unfortunately happen prey to accidents or accidental death. Also, we would like to request the, my Joint Secretary was presenting about the NRTS, but of course there are difficulties and technical problems, with, like many people are yet to get the cards issued by the NRTS from the State Nursing Council due to some lack of coordination at state level or in the technical difficulties. I think definitely we have to look up, because only 10 lakh people are registered and many of them are yet to get the numbers. So maybe due to delay in approving the or verifying the documents at the state level, this will be something like which if you can, though such a well-planned system, if it doesn't work at the grassroots level, may have difficulties. So I request by the next Nurses Day, we will have that all these problems solved and people will have cards in their hand, because many people are complaining that they are not getting cards. It is not displayed on the online portal, or it is not dispatched from the State Nursing Council. There are difficulties. And once again, giving the, of course, the time is up. I am sure that we are running out of time. Once again, thanking the Indian Nursing Council for organizing this webinar, and wishing all the colleagues a great Nurses Day and a great year ahead in contributing to development of nursing and to improving the quality care we provide to our clients and society at large. Thank you very much.
Thank you, Dr. Roy, for encouraging all the nurses who have joined us today. And now I invite Mrs. G.K. Khurana. Madam is the Secretary General of All India Government Nurses Federation. She is the ex-Deputy Nursing Superintendent of Dr. RML Hospital and a very known figure in the ministry, as she's working towards various issues related to nursing welfare for the last 55 years. Ma'am, we welcome you and we request you to please say a few words to all our attendees and ourselves.
Thank you very much for giving me this chance to wish my all colleagues, national level and international level, a very, very happy Nurses Day. Much has been said that the nurses are doing this. Of course, nurses are doing this from bottom of their heart in many difficulties when they are very less in number and without promotion, without any upgradation, without sanctioning the staff for new departments. So many problems are faced by nurses. Even then they are working day and night, and the latest is the COVID position when they don't have to go to their homes for months together to see their children because they had to stay away from their families. So these these types of problems are faced by nurses. You know, my aim in life, my organization aim in life is that we should see the problems faced by the grassroots workers, the nurse who's in the field, the nurse who's in the ward, who's in the emergency, who's in the public health sector, is the A&M working in the centers, small centers, and so many small things have been, they are looking after the patient and the public. They are the really service. We have very senior post created, but not filled up. We are talking about the education, but where is the faculty to teach them? Everybody knows. We have created directorate in the nursing, but where are the posts? The new departments are opened with a great difficulty. You get something at the junior level, but no post at the senior level. So the justice with the patient cannot be done without proper sanction of the staff. The theme is that to investment in nursing. Investment in nursing is that to invest, do the nursing for the best nursing for the patient. But best nursing only can be done that if one nurse is to be looked after 6 patients in general ward and one in ICU ward, which is not there in the hospital. Not in the government hospital. The problem created this is because the norms, even accepted by the ministry, even not perfect, but something is there, is not implemented. This is very hardship is faced by the nurses that is been looked after by us. And I think all many things are very important, but the looking after the grassroots problem of the working in the field, working in the wards, working in the ICUs, working in the COVID center or infectious diseases center. So many, I think, nurses are facing. I think we should be united to look after these problems. The higher things we are talking very high, but education is all, nurse practice is all right. Everything is all right. I'm very glad that the Indian Nursing Council has collected so much data. I was really surprised how much time it must have taken. I'm really grateful to the Indian Nursing Council for taking this. At least we know something where we are. So I think much is done by the Indian Nursing Council, and we all should together do something to improve our nursing. Thank you. Hello.
Yes, ma'am. You're audible, ma'am. Your face was getting cut. We can see you now, ma'am.
हाँ क्यों आवाज नहीं आ रही थी? हेलो
अब आ रही है मैम. आपका फेस कट रहा था. Please go on, madam. Please continue, ma'am.
Face कट रहा था. हाँ. So I was talking about the real problems faced by the nurses, who are working in the grassroots level, working in the ward, working in the emergency, working in COVID, working in super specialty departments and especially surgeries, the minister, the honorable minister, talking that the nurses are linked between the patient and the doctor. It is okay, they are linked between, but they should also be looked after well. I think in our ministry, the doctors are looked after very well, but we are not looked after. That should be. We are called COVID warriors. We are always praised. This I've been listening for more than 60 years now. The nursing is a noble profession. But what is given to the noble profession? That is that made me to do something for the profession, which we could do little things. I think the more and more has to be done to improve our nurses' facilities. They get promotions. They are enough to look after the patient. They can only look after the patient if they have to look after the one patient in ICU, and if they have to see the 10 patients in ICU, they can't justify. So I think these things, these problems need proper care. And I think all nurses should unite for this. And then we can achieve our goal time to time, taking up with the ministry and taking up with the others who are responsible for this. I think always our secretaries talk about, I was listening to additional secretary, they always say education, education. Education is okay, but educated people, where are they posted? Educated people are just, not getting any post because the post lying vacant. So side by side, we have to look after this, the problems of nurses. And I think these can only be looked after unitedly. I'm really grateful to Indian Nursing Council for taking this today, having this webinar, and so that we could at least celebrate our International Nurses Day. Once again, I again wish all my colleagues and seniors and juniors very, very happy Nurses Day. Thank you.
Thank you so much, ma'am, for your very encouraging words. You have very lucidly brought out that there are so many issues related in investment, like creation of posts, filling of posts, or a proper remuneration. And we are very thankful for you to take up these issues at various platforms. Thank you, ma'am. Now, may I request the President, Indian Nursing Council, Dr. T. Dilip Kumar, to please address and make his remarks. Sir is the ex-nursing advisor to Government of India and also a member of the Global Nursing Group of WHO. Sir, we are indeed happy to have you as our team head, and we request you to please give your remarks.
Am I audible? Good afternoon.
Yes, sir.
Yes, sir.
Greetings on behalf of the Indian Nursing Council. Once again, I would like to extend greetings to all the nursing fraternity in India and abroad on the occasion of the International Nurses Day. I think the very important theme which the International Council for Nurses has given, I think what Bharti was making a mention is data dialogue. I am telling you, I think we are getting this national health workforce accounts only in the year of 2020. And to now I think whatever the 10 modules which now the WHO is asking. So because Indian Nursing Council was able to give the data on the basis of the whatever the nursing registration tracking system we have collected and we have handed over to the, and now in the last Chintan Shivar, when the Honorable Health Minister took, where all the regulatory bodies was there, I think the Honorable Health Minister told the other councils, why can't you do like Indian Nursing Council has done it? See, it's very easy to say that it's not workable. I think we all know that who are the obstacles not to work this system. I think you being a professional organizers and heading the professional associations and you know very well who is the culprit in blocking this implementation of the nurses registration tracking system. At least we are very happy to inform the government. Even n number of times ministry is telling all the people the information with the way the Indian Nursing Council has collected, why can't you collect? Now other councils have started following our footsteps. Unfortunately, the COVID-19 came into this thing, and otherwise we by this time, to give an example, what I think Rai was making a mention that about in Kerala, 144,000 nurses have been enrolled. Out of the 1 lakh, it has been verified, 119,000 nurses have been verified. So 107,000 NUID cards have been issued. For example, Mrs. Sarojit Kaur, who is working here, though she has registered in the Punjab Nurses Registration Council, she could download the NUID card from the sitting in Delhi. No need to go to the... So there is a opportunity is available to download the NUID cards. We have given help desk, and if they are not able to download it, they should be able to inform us so that we'll be able to facilitate for downloading. And to a certain extent, some of the people who are working in a very important positions are not willing to implement this nursing registration tracking system. I request the professional associations and the organization, they should take up this issue. To tell you honestly, it is the role of the professional associations to ensure the standard of nursing education. If you don't have a data, you will not be able to have a dialogue with your government. As a professional association, as a trade union people, if you don't have a data, I think that's why what the WHO, that arrow mark was presented by the Bharti, that was the arrow mark was given by the WHO, the National Health Workforce, data dialogue. If you don't have a data and dialogue, you will not be able to achieve the end results of the nurses' working conditions and all those things. So therefore, my request to you is that we have a solution. It is, we request the professional association, they should take lead. They should take lead, because ultimately we have a solution. We have given a digital solution. If we are not able to get this, that's what I am not able to understand why they are not able to. Out of the 10 lakh, the nurses have been enrolled. We have 6,48,000 people have been already NUID card is issued on the basis of our data. There are maybe an issues, maybe the dispatch and all those things. So why can't your state branches of the Trained Nurses Association of India take up this? I think I have to, I myself many a times in the states I am interacting. I think Rai, you have a big responsibility of, because this is the tool we are giving. For a professional association, this is a tool we are giving. That tool has to be utilized. How can you utilize it is left to you. We can create a tool. We have created a tool. So for you to argue with the Ministry of Health and Family Welfare, you need a data. Like what Bharti was telling about how many are post-basic BScs, how many are, so far we never had a data. So now we have a data. So this data, how to utilize this data, I request the Mrs. Kurana and also Rai to work with your state branches, because I'm telling you, whenever I interact with the TNA people in the state branch, they are not even taking interest. They are not even taking interest. So you have to create a congenial atmosphere from the headquarters so that your branches are well heard as and when we are talking with them. So therefore, yes, we have a data. This is going to be helpful. Whatever we said and done, we have invested the money for creating this data. And this data has become, at least to tell you, the Ministry of Health is so happy to have the data. No other regulatory bodies so far are having. Yes, we have a teething problem. I am telling you, the teething problem is coming from our own nurses, nursing and midwifery professionals. So therefore, there is a need to educate them to make this whole NRTS is a, because I think what Bharti presented, only one part of this thing. We have to give the data to the WHO Geneva. Every year, I think now the Ministry of Health is going to ask all the states to give the data under the name of the National Health Workforce Account. It's going to be every year affair. And already Ministry of Health has created a nodal officer in the Nirman Bhavan. That nodal officer is going to talk to the state. At least in our nursing sector, reasonably we are away ahead from the other regulatory bodies in terms of the data. Once you have a data, you can definitely play with that regarding for the effective manpower planning, how when they are going to retire, all those things which will help for the data. So therefore, at least the theme which has been selected by the International Council for Nurses. I am telling you repeatedly, I have told, it is a music to the ears to me. It is a music to the ears to me because the theme which has been, they have captured the 4 themes in the State of the World Nursing Report and the State of the World Midwifery Report. Now it is, they have like education, the investment for education. I think very important thing which is in this theme is coming is jobs. Nobody used to talk earlier about it. It talks in this theme, it talks this, the WHO is telling the countries, create the positions. What I think Mrs. Khurana and TNA may be asking repeatedly with the government, state governments and the government of India, create the posts. I think this creation of a post is which is coming from the now from global level to the countries. You create the positions, leadership, and they are also telling senior positions has to be there for the leadership. So which is a very pertinent for India. We don't have a nursing organization even at the national level, at the state level. So I think now the nursing professional associations, you have a good tool. Now you are getting a lot of tool is coming from the International Council for Nurses. Now you have to take to your state governments how even wherever the nursing leadership positions have been sanctioned at the state level, neither have been filled. Not even if they are there, the files are not going. And that is the level we have at the present of the. So therefore, the theme says leadership, create the leadership position. And also it tells about the delivery, service delivery. So in that, it covers the various issues of the working conditions, and very much this theme is capturing the rights, working condition, the word rights which has been reflected in the theme is they want to pay the nurses and midwives safety and their working conditions. And these people, if we are able to provide a good working conditions and good safe environment for them to provide a good global health. So that's why this year theme is very, very important, at least to India, I can tell you. So now we have to take this theme and with the data, we have to argue with the governments. And I think the World Health Organization in the last 2021, they have made this whole 2 global reports in the form of a SDNM, Strategic Direction for Nursing and Midwifery 21-25. The 21-25, now World Health Organization has sent it to the all the countries for the implementation. At least we Indian Nursing Council, we waited for that strategic direction for nursing and midwifery report to come to the Nirman Bhavan. It has come long back. So what we did was, we had a sensitization with some of the member of parliaments, which the Indian Nursing Council initiated. And one of the member of parliament, I think I have shared that letter to many of the people, that member of parliament brought out this. There is a strategic direction of nursing and midwifery. The resolution which has come from the World Health Organization, please implement that. So that's how now at least we got in reply from the Ministry of Health and Family Welfare. Now they have appointed a committee to study the strategic direction of nursing and midwifery report. That is the resolution. This resolution captures all the TNAs and the Mrs. Khurana's demands to the governments. Whatever you have a demands, all these has been captured. I am telling you, it has captured much more than in the strategic direction of nursing and midwifery. So this strategic direction of nursing, now it is for the professional association and to the nursing groups. That is the reason we created this change, the Nursing and Midwifery for Change group with the JAPAGO and the Indian Nursing Council and the TNA and the Mrs. Khurana's group of All India Government Nurses Federation, called as a Nursing and Midwifery Change. So now this, at least some sensitization has been made, and now the ministry has constituted a committee. Unfortunately, one-man committee has been constituted, and you know how our leadership is there in the Ministry of Health, and that we were not knowing. But when we raised this issue with the ministry, after receiving this receipt of the letter, till that time, we were not knowing this committee, because we expect our nursing representatives, whoever is there in the ministry, are expected to share, at least not to the regulatory body, at least they should share with the professional associations. And such a committee has been constituted. And committee, I was told, we made the JAPAGO to interact with the chairperson, and repeatedly, not a single meeting has been held so far. So therefore, the committee has to be active. And in that letter, the member of parliament wrote to that the Ministry of Health, study this report, share this report to the state governments, and fill up the nursing organization posts at the national level and at the state level. Hopefully, this committee has to meet at least once or twice and to study the report, and we should put pressure on the ministry about this report. And fortunately or unfortunately, at least now, ministry working in a different Chintan Shibar, which the Honorable Health Minister organized. In that, a lot of issues of the nursing issues, which has been flagged in that. But again, it has to be reconciled with that strategic direction for nursing and midwifery in totality, with the education, leadership, service delivery, working conditions, all have been reflected in that resolution. Now it is for us how best we can get these resolutions are implemented at the national level and at the state level. It is left to the our nursing groups again. So therefore, we should not have a narrow aspect of thinking some of the issues. And many people think only with the institutional level politics or the state level politics is not going to help. You have to ask a bigger agenda rather than smaller agenda, which I used to hear from many of the policymakers who are nursing groups only comes with asking only small things. You should ask big things. So therefore, the strategic direction of nursing and midwifery is a big thing, which we have to see that how can we get it implemented. And once, if it is at least implemented, and I'm very happy at least Mrs. Khurana had a meeting with the Joint Secretary, and I am very happy to see the 25 issues which she has raised with the Ministry of Health, and all are related to some of these themes like creation of the post, career progression, all those issues, even the pay scales, all have been reflected in the 25 this thing. Even that, I think further meetings have not been held because of the COVID. Somehow the ministry has not called the Mrs. Khurana once again. Your madam was telling that they have given a reminder to convene a meeting. So the substance is, this is where a good opportunity for the nursing and midwifery profession we have. It's a God-given gift of this SDNM 21-25. We should make use of this to get it, because 4 years are there, because they have to report back to WHO. So we have to create an awareness at the state level, because this is not only, I think we should, I think somehow or the other I have seen in India, in nursing sector, everything they look for the Delhi. I think nobody prevents to download the strategic direction of the nursing and midwifery resolution. Why can't they discuss at the state level? Why can't they sensitize the member of MLAs? Because the MLAs, see, again, I am telling you now that I have come to a conclusion that any assembly, when a discussion goes on health or in the parliament, the health minister or a health secretary, they don't listen anything on nursing in their assemblies. So they feel this nursing sector is very happy. There is no need to address any problems. So they go with a very happy health sector, health minister and health secretary. So therefore, there is a need for us at the state level to raise these issues. We're not only looking for the center, because the state, now you know how the states are independently taking policy decisions, and even they are taking a lot of money from the various financial institutions upgrading the health facilities. So therefore, if the state wants to do it to help the sector, nobody prevents the by the Union Health Ministry. So my request to all the professional and interest groups is we have to take up this strategic direction nursing, a piece of resolution which has come, and we should educate, sensitize policymakers at the state level, so that we will be able to achieve within a span of 4 years, 21, 25. We may be able to achieve many of the, at least my agenda, at least in my opinion, if we are able to fill up all the 5 positions of the nursing position at the national level, and all the posts created at the state level directorate are filled up, and if the state has not created, they should create it, and files, they should be involved in policy making, because I have seen some states, they have a position, but not a single file go to that person. That is not going to be useful. So I think, yes, we have a lot of issues and challenges and problems the nursing sector is facing. We have some tool is available in the form of this strategic direction of nursing and midwifery, and we have a good theme of this World Health ICN has given. Now it is for us, for the professional associations and the various interest groups and trade unions associations, they should all work together to see that these are implemented. Instead of talking, it has not been done. This, I think, this will go on. This will go on. So therefore, we have to work together with one agenda of achieving this, the SDNM resolution. It means the implementation of this SDNM. With this, once again, I would like to extend greetings to all the nursing fraternity in India and globe on the occasion of the International the Nurses Day, and which I think this today the ICN is going to release the tools and all those things. But I think the sensitization, the leadership in each state level have to come together, because it's not going to be always if we sit only Delhi has to give the decision. It is not going to be there. I think at the state level also we should make an effort to sensitize to get these resolutions are implemented. Once again, I would like to thank one and all. Once again, I would like to convey my greetings to International Happy Nurses Day to all of you. Thank you very much.
Thank you so much, sir. So we are getting some questions and remarks in the chat regarding NUIT. So with your permission, could I show?
Yes. Without even question, I myself sent a message for you without even a chat. Because when I heard this rise, there are a lot of people are not getting the. I think many people are not able to realize how difficult to conceptualize the NRTS, because you people, if you have worked at the policy level, you could have realized how people want to stall this process of this NRTS. That is very unfortunate and very unfortunate. Anyway, please show it, madam.
Sir, 1 minute. What I told you is NRTS is a very good scheme, as you have briefed us, and Radhi has shown it. Like, there are complaints from nurses due to teething problems and problems at the state level, the council level, state nursing registration council. There are problems because they are not getting timely information. So people are complaining. In some states, there are same days number for different nurses, because they have started registers, and before digitalization there was problem. Such issues only I mentioned, not that we have to settle that also to ensure that maximum people gets the cards, because 10 lakh is a big number, but compared to the total number of nurses available, as Joint Secretary mentioned, we have to enforce it through the state councils. Then only there is full support from TNA at state level. State branches have been made aware. They are following the state councils.
Mr. Dr. Rai, you not only looking the center of the INC, you people should take the state nursing councils.
Yeah, we are talking with state nursing councils. We are talking with state nursing councils. To follow up and get the cards done.
I can tell you the examples how the state nursing councils are stalling the process.
I know that. That's why I mentioned that. That's why, sir, I mentioned that. I am not naming the state. Some states fully stalled.
Therefore, if the professional associations have to lead this. See, we have provided the platform. It is for you to argue with the ministry. You need a data. We have created this thing. So you have to take a lead, because until unless simply a professional association and the unions simply, if you go to the ministry with the data, I am telling you, many of the IAS officers, if you talk with the data, they will listen. Then you have an evidence. I think our Mrs. Sarojit Kaur, at least she is going to demonstrate how to download the NUID card.
The status of
She will demonstrate. At least it may be useful for some of the people who are participating in this webinar. What is the process is involved?
Of the country. Stop sharing over here. Thank you.
So this is, I think, I expect all the professional associations and the Mrs. Khurana organization, you should educate the people if they are telling that we are not getting the NUID card. I think this is a typical example. It has took about 6-7 minutes of accessing the online NUID card. So they should download it. That's all. If as and when they get this thing, that will come by post. But you have an online NUID card. So we need more education. I think that's why we involved even the professional association the day one in all our the meeting which we had dialogue. So my request to you people is, please educate them to download this whatever, and even there is a provision to change the mobile. And to tell you, as Bharti was telling, is health minister is having another agenda is how to attract foreign students to come and study in India, how to send our nurses abroad to have the foreign exchange. So therefore, we sent one mail, how many nurses are willing to go abroad? A SMS went. I think she got about 10,000 people are willing to go abroad. She got it within a week. So that data we can share with the ministry. So that's how it is helping now. So we can, once if this whole process works, we will be able to share many of the continuing education, some of the latest messages where the Ministry of Health want to focus it. We can send it through the SMS to all the nurses so that the latest messages can be transmitted. So this is a good tool is available. It is for us how best we can utilize this.
Thank you, sir. I hope that looks after some of the queries that have been coming up, and remaining we'll be replying back through the FAQs. May I now request Dr. Ashish Sharma, Vice President of Indian Nursing Council, to please give the vote of thanks for the second half. Ma'am, can we have your video on, please?
Thank you, Madam Lieutenant Colonel Sarojit Kaur. A very good afternoon to all the dignitaries on the dais, Mrs. Khurana, President, All India Government Federation of Nurses, Dr. Roy George, President TNAI, guests, and the entire nursing fraternity who have joined today's webinar for celebrating International Nurses Day, which is on ICN theme for celebrating the International Nurses Day. That is, nurses, a voice to lead, invest in nursing, and respect the rights to secure global health. I think this theme would focus on the need to protect, support, and invest in the nursing profession to strengthen the health systems globally. As we are close to the end of today's webinar, it is my proud privilege to deliver the vote of thanks. I would like to express my heartfelt gratitude to Dr. Punita, Senior Consultant INC, for her gracious presence amongst us today and unfurling the International Nurses Day theme. She highlighted many initiatives taken on part of the INC as well as the Ministry of Health and Family Welfare to strengthen nursing and education, nursing and midwifery, education, training, and delivery of services. and thereby raise the status of nursing personnel. Thank you, Dr. Punita, for sparing your valuable time and for ever extending your support to INC initiatives. Mrs. K.S. Bharti, Joint Secretary INC, she spoke on the National Health Workforce Accounts, which is gaining national importance, and explained the 10 modules which are aimed at strengthening the quality and quantity of the nurses required for providing nursing services. She also further highlighted the objectives and the process and outcome of the NRTS initiative of the INC, which is highly appreciated by the Ministry of Health and Family Welfare. And especially it is very important for the National Health Work Account System planning. Thank you, Madam Bharti, for explaining NRTS with so much ease. Dr. Roy George, President, TNAI. Sir, we are very happy to have you amongst us for celebrating International Nurses Day. The importance of ICN theme was highlighted for the benefit of nurses globally. Your announcement for the free insurance cover of 10 lakhs for Indian nurses opening on 2022 International Nurses Day today at 7 p.m. 12th May is welcomed wholeheartedly. I'm sure all nurses will be very appreciative of this. Thank you, sir, for your gracious presence, sparing valuable time and motivating words to our nursing fraternity. Mrs. Khurana, President, All India Government Nurses Federation. Madam, we acknowledge gratefully your gracious presence at this webinar. You pointed out the problems, issues, and challenges faced by nurses in a variety of healthcare settings, especially the grassroots level. You also emphasized the government, Ministry of Health and Family Welfare should look after the nurses in all respect by taking actions and not by just lip service. Thank you, Madam, for concerted efforts of your Federation for all nurses to address these issues to the government and extending your support to INC at all times. I know that you never lose any opportunity to take up these issues at any forum that you feel is deemed fit. I also wish to acknowledge gratefully Dr. Dilip Kumar, President INC, for your gracious presence and sparing valuable time to address the nursing fraternity. You stress the role of associations, especially that is TNAI and the All India Government Federation of Nurses, especially for the National Nurses Workforce data for planning and organizing the nursing education, training, and services. You also highlighted the need for implementation of the SON and the SOMI reports by strengthening the national and state level organizational structures, because unless those positions are filled up and there are people functioning and they are really the correspondence goes through them, we'll not be able to achieve any of these recommendations which are so strongly put up by the SON and the SOMI report. Sir, thank you for your unconditional continued support for the growth and development of nursing profession at all forums. Thank you, sir. I wish to thank Madam Lieutenant Colonel Sarabjit Kaur for commencing and moderating today's webinar with high spirits. I also wish to thank Dr. Sarabjit as well as Madam Bharti, their efforts for organizing today's webinar and celebrating the, facilitating to celebrate the International Nurses Day at a very short time. I know hardly it is done within a day or a half, that's all. So thank you very much for your all these timely efforts and making this, making all of us to celebrate this day today. Last but not the least, I extend our heartfelt gratitude and thanks to our dear nursing fraternity for joining this seminar today and celebrating the International Nurses Day together. You see, the provision of unconditional, committed, untiring, sincere, and dedicated services to not only the Indian, but even global population by all our Indian nurses is gratefully acknowledged. We wish all the nursing fraternity a great success at every step of their professional life. Once again, I would wish all the nurses, all the nursing fraternity, not only India, but globally, a very happy International Nurses Day. Thank you one and all for getting together to celebrate this day today. Thank you very much.
Thank you, ma'am. So with this, we come to an end of this program today. I know we're running a little late on time, so I'll close by just saying to everybody once again, wishing you a very, very happy Nurses Day. And we hope that we'll all work together, join our hands together for investment in nursing. Thank you all for being with us. Have a great day.
Thank you.